Welcome to the TheWellnestMamas podcast. We are committed to leading a sustainable lifestyle and making community connections. In a world where stress and chaos seem to be the norm, finding balance and fostering a sense of true well-being is essential. This podcast is your guide to embracing a holistic approach to wellness and building a healthy community around you.
Each episode, we will dive deep into various aspects of holistic wellness, including mindfulness, nutrition, fitness, mental health, and much more. Our expert guests from different fields share their knowledge, experiences, and practical tips to help you lead a healthier and more fulfilling life. Whether you are just beginning your holistic wellness journey or you are already deeply dedicated to the practice, this podcast is for you. Join the Wellness Mamas as we uncover the secrets to holistic wellness and discover the power of building a healthy community that supports and uplifts one another.
So sit back, relax, and get ready to embark on a transformative journey to leading sustainably healthy lifestyle. We're glad you're here.
Welcome back, everyone. It's Wellness Mama Steph, and I am here with
Caitlin
and
Taylor.
Taylor is a functional medicine PA, correct?
Yes.
Is that your full title?
Yep.
Okay,
Yep.
Cool. So we're going to get started and talk about it. Do you have any questions for Taylor?
Yeah, what's a PA? So I'm a physician assistant, or now physician associate is the proper term technically. So I basically have the full scope of practice as like a medical doctor, but I have a supervising physician, and there's just a couple medications that I can't prescribe, which I don't anyway. So anyway, yeah, I'm a full practice provider.
How cool. So functional medicine, I've heard that term before.
Yes.
And I understand it to be kind of you looking at the full function of the body. Can you explain a little bit more what functional means?
Yep. So I have a couple ways to explain it, and I'm happy to explain it. So I always tell people on one side of the spectrum with medicine, you have conventional medicine. So what we're typically used to for like hospitals, our typical GP, general practitioner, etc., kind of a pill for every ill kind of a thing. And I was conventionally trained, right? So in PA school or in medical school, we're trained to see a patient, assess them, work them up, do a physical exam, diagnose them, and treat them. And treatment's usually a medication, a referral, a surgery, etc. Okay? On the other side of the spectrum, you have alternative medicine, right, that uses no medication. So they use more like tinctures and healing modalities and other therapies. In the middle of that, if you come to meet in the middle, you have integrative medicine, so where medications are used as necessary, but probably more first line is a supplement or an herb or lifestyle intervention, etc. And I practice that kind of medicine, but functional medicine takes it one step further. So we look for the root cause, right? So I like to give an example like hypothyroidism. So someone comes into an office and say they're cold all the time and they have trouble losing weight, they have dry skin, and maybe their hair is, they're losing hair. And their provider runs a TSH, which is a whole nother story, not running a full thyroid panel, but just a TSH, and say their TSH is high, and they're like, you have hypothyroidism. Let me put you on a thyroid medication like Synthroid, okay? So fine, I kind of do a similar thing. I obviously look at the patient, I do a physical exam, I do more detailed blood work, and then, I might diagnose them with hypothyroidism. But from my standpoint, and I might treat them, like I do use medication when necessary. It's usually not first line, but there's a time and a place, right? And so functional medicine takes it one step further when I'm always thinking as a provider, but why is the thyroid not functioning appropriately, right? So what are some of the root causes of the hypothyroidism? How can we correct that imbalance or those root causes so that either we could prevent medication, we could get people off medication, or we could prevent further disease? So that's kind of the take there, is that with every patient, I'm always thinking like, okay, they present with this, and this, if it's hormone imbalance or infertility or IBS, well, what's causing that? And I'm not just slapping a Band-Aid on either medication or supplement, still a pill for every ill, but I'm really trying to get to those root causes so we can get people well.
Wow. That seems like what we want.
It's like good medicine, and I think that's where unfortunately in the medical field, I think traditional medical doctors view functional medicine as just either completely alternative or quackery, and it's not. It's evidence-based, and it's good medicine. You know, it's good medicine. So I would do nothing else.
Yeah. Wonderful. So how did you go from traditional, conventional PA to functional medicine? Like, what led you down that path?
Yeah, absolutely. So I'm going to make a really long story a little more condensed. So I grew up in a very kind of medical, health-minded family. My dad was a physician. My mom taught fitness classes. So I grew up like active and eating healthy at home, etc. So it's kind of a way of life. I went off to college and I took a food science class my freshman year. I didn't know what I wanted to do with my career and took that class, and I was like, I love food as medicine. Like, I want to help people heal through nourishing food. So it was then that I decided I wanted to go to registered dietetic school. So I was pre-med, registered dietitian, went to dietetic school, and I just remember sitting in class and we were learning like about FDA recommended diets. And I remember sitting there being quite frustrated, just saying, you know, there has to be something more. Like, there has to be something more to this. I want to learn how food affects the body and how we can nourish the body rather than, you know, what we were typically learning in school. So it was partly that made me seek out and first learn about like integrative and Ayurvedic medicine, and then later functional medicine. And then to put another layer on that, I was struggling with my own health issues. So in college, I had some really bad IBS, GI issues. And unfortunately, I was kind of just, I don't want to say pushed to the side, but kind of like, oh, you're fine, you're a stressed college student, like with conventional medicine. So, and yes, stress was a component of it, but I knew that there was another layer to it, right? So it was partly my own health story, and then partly just me loving food and just health and wellness and how to like treat and heal the body naturally. From then I graduated, and I was lucky enough that my first job as a dietitian was in integrative and functional medicine, and I just hit the ground running. I did like a graduate program in integrative medicine through KU Medical. I did a lot of webinars, seminars, conferences. I was just like, couldn't get enough. And I had multiple jobs as a dietitian. I actually at one point started my own business as a dietitian, and I was consulting with different functional medicine practitioners and seeing their patients. And then I got recruited to Austin, Texas to work for a pretty well-known functional medicine provider at the time, Dr. Amy Myers. Specializes in complex chronic illness, autoimmune issues. So it was an opportunity I just couldn't pass up. So moved down to Austin, was working there. It was amazing. I was just seeing like how a well-oiled functional medicine clinic was running, and got to work with patients from all over the world that would come in for, you know, healing and a good functional medicine approach. Unfortunately, though, there I feel like I neglected my own self-care. I was working a lot, and again, I was working and I was doing another functional medicine certificate at the time and working over, you know, maybe 50 hours a week. And unfortunately, during that time, I was diagnosed with hypothyroidism, and then I was diagnosed with 2 melanoma skin cancers at the time. So it was my wake-up call, and this was in my early 20s, and it was my wake-up call of like, Taylor, like, to help people, you have to be practicing what you preach, but you need to help yourself too, right? And so I really had kind of a come to Jesus moment of, okay, something has to change here. Like, I love what I'm doing, but something has to change, and I have to prioritize my own self-care and mostly like my stress level. So I thought about going back to medical school versus PA school. Kind of came to the conclusion I didn't want to go back to school for another 8 years. So PA was the route to go for me, and I felt like I could do everything I wanted within my scope. So I went back to PA school and went back then knowing I wanted to do functional medicine, wouldn't do anything else. So I went back, learned more conventional medicine, which I would say was hard, but also a blessing, because again, time and a place for conventional medicine, time and a place for acute care, right? And then since then, graduated, I've worked in a couple different functional medicine clinics, and I got my practitioner certification through the Institute for Functional Medicine. And then recently, I'm starting my own practice in Northwest Arkansas. So, very long story, but includes, like I said, just my love of natural healing, and then obviously, like a lot of other functional medicine practitioners, like helping myself too, trying to figure out what was going on with me, and that led me to just wanting a different alternative approach.
That's so good. We need more functional medicine practitioners in NWA. So
such a need,
and quality accessible practitioners.
Yes.
So, yeah.
That's really exciting. Yes, and I know when I went into the medical field, I was because I wanted to learn more about what everything meant. Like, I felt like there was a paywall, to understand what you guys are talking about. I was like, I need to know what,
Yes. Oh, yeah.
For sure.
So where do you see the future of your practice?
Yeah, well, I'm really excited to get involved locally. Since my husband and I moved back, I just have been feeling called to get involved locally. And I hope that, more than anything, it's a light to the community. I hope that, I can provide a place of healing and wellness, just so people can not just live and not just survive, but really thrive. I want my patients to live and live abundantly and feel like they have vitality and stamina to, enjoy time with their kids or their spouse or a loved one, or be outside and go hiking. So that's my goal for my patients, is just to help them find really whole healing, mind, body, spirit, soul, and to just help them live vibrantly.
Wow.
Yeah.
Love that. That's so great. That is so great.
So where is the best place to contact you?
So a couple options. Actually, I'd say best option is my website, and I'll give that to you guys to link, but it's mywholewellness.com. And then email will be on there. Instagram is another great place to follow me. I try to post healthy tips and just good resources on there. And I'll give you guys that to post too, but it's Functional Med PA at Instagram.
Wonderful.
Okay, cool. I know you talked a little bit about thyroid panel, and you said TSH. I don't want to get into that, but I think that we should. I think that
That's fine. This is
the tip.
One of my favorite topics.
Yes. If we are concerned about our thyroid health, and our family doctor is just ordering a TSH, and we're like, no, we think that you need to get more detailed into it. What is the full thyroid panel that is your first line of defense when someone's just coming to you and saying hey, I'm tired?
Yep.
Yeah.
So realizing TSH is not a thyroid hormone, right? It's from our pituitary. So in some cases, it can be accurate. When TSH rises, it's basically saying, hey, you need more thyroid hormone, produce more thyroid hormone. So it can be accurate to diagnose hypothyroidism, but it's not the full picture. And a lot of times I'll see TSH normal. Another side note is reference ranges on labs are not always optimal. I'll say that too, because TSH could be 5 and normal on a reference range, but I like it ideally 0.5 to 2-ish, give or take, based on symptoms and other labs, okay? So anyway, sometimes TSH is normal, but you have low free T4, low free T3, high reverse T3, whatever. So as a tip, what I consider a full thyroid panel, and I have this on my Instagram too, people can reference. TSH, thyroid stimulating hormone, free T4, free T3, reverse T3, and I usually on new patient panels check thyroglobulin and thyroid peroxidase antibodies as well. Even if you can't get the antibodies up front, that's okay. You can kind of see what the other panel looks like, but then say you do have, low thyroid hormone, I would suggest getting antibodies to see, is it Hashimoto's, right? Again, what is one of the causes, right? Is it or no? Is there some other dysfunction that's causing the thyroid to not produce? So that's my little tip with that. And there's, obviously, if you can work with a good practitioner to run those on you, be able to interpret those, look at optimal ranges, not just the reference range, because that's really important too.
Yeah.
That's an incredible tip. Thank you so much for coming and talk with us today.
Absolutely.
This was so much fun.
Thank you guys for having me.
Of course.
All right, bye.